Phoebe primary care physician Dr. Akar Thacker and I are here today to talk about vaccines. That's a topic that's been in the news a lot lately because of COVID. How do vaccines work?
So there are different types of vaccines out there, but in general, when someone has an infection of any sort, your body responds to it using the immune system, and fever is the first sign that most people will recognize for that. And then after that, the vaccines are supposed to prime your immune system to recognize the infections early instead of waiting about 2 weeks and then respond to it early so that you can feel better and get better overall faster. That's the whole point of vaccines.
What is the main point, the most important information people need to understand about vaccines?
I suppose the main point is that it is all the vaccines that are available right now are pretty safe. They have gone through rigorous testing in many different situations worldwide, and they're only available to public after it has gone through the scrutiny of science to make sure that it is actually safe to do.
Let's talk about childhood immunizations.
Sure.
What vaccines are available and important for children?
There are quite a few. It starts very early, chickenpox, polio, HPV, Tdap, the big ones that come to mind rapidly, but there's a whole immunization schedule for children to prime their immune systems to work against the viruses and bacteria based on age. And you can see them at the CDC's website and reference every single one of those vaccines over there.
And if parents take their children to the pediatrician regularly, then the doctor will keep them on that schedule?
Yes, sir. So they're supposed to keep them on the schedule. All the visits are supposed to be made according to the vaccination schedule as a well-child visit to begin with.
So what about adolescents? Are there separate vaccinations when children get a little older they should have?
Yes, sir. So depending on where they are going, whether they are going towards military schools versus college versus other places, there are different vaccinations which may be boosters or a new vaccine like meningitis vaccines that come into picture just because those are high-risk areas where they can be exposed to those specific bugs.
I know the HPV vaccine is one that's recommended for adolescents. HPV is a sexually transmitted disease, and a lot of parents may say, you know, my 12-year-old isn't sexually active. There's no reason for them to get that vaccine. What do you say to parents?
So HPV is a sexually transmitted disease, but also causes a lot of different things, wart-like lesions and such, in men and women. And the best effective time frame to get the vaccine is in the early adolescent stage. You can still get it as an adult, but if you get it done earlier, then by the time they are sexually active, which is going to happen at some point, they're already protected, they don't have to worry about anything.
And then there are vaccines that we should take once we're a little older, right?
Right. So there are quite a few vaccines depending on your medical conditions that are recommended throughout your lifetime. And once you hit about 65, there are a few other preventive vaccines against bacteria like pneumonia, which are very specific to that age group.
Now the flu vaccine is one that basically anyone other than very tiny babies that is recommended for every year. Talk about the flu vaccine.
So the flu vaccine is interesting just because every year it's a different vaccine. It's not the same vaccine every year. And it's estimated by this whole group that does a survey throughout worldwide as to what strain of the flu is possibly going to be going around in different locales of the world. And CDC ends up making the best estimate possible, which usually turns out to be about 60% to 80% match, and gives you a boost against the flu vaccine or the flu virus that's going to be prevalent in the area.
And then, of course, the COVID vaccine. There's been a lot of misinformation out there about the COVID vaccine. What do you want to tell people about it and why the COVID-19 vaccine is important?
So COVID-19 vaccine is very important, especially the ones that have been 95% or more effective in all the studies that they have done so far. They work very well. The side effects are few and rare. And the effectiveness is such that many of the places that are hardly hit by COVID, for India or Brazil and things, they are wanting those vaccines, and then many places that have the availability of vaccines, they're kind of ignoring them. So.
And with the COVID vaccine and the flu vaccine, it's not 100% effective. You may still get the illness with both of those vaccines, but even if you do, it'll likely be much less severe, right?
Right. So vaccines in general, they're not supposed to be a barrier that's going to be 100% effective at preventing the disease. But if you do get the disease, your body is primed, so it reacts faster, and you don't end up in the ICU setting or any kind of severe condition because of the given condition that the given disease.
And most vaccines, if they have any side effects at all, are relatively mild, correct?
For the most part, yes. They are very localized. There are a few generalized, like body aches and fevers as a reaction that your body is getting. And any outside of that, symptoms that one may have are secondary to the preservatives that are used, so egg allergy or things like that.
Dr. Thacker, thank you so much for sharing your expertise and your insight on the importance of vaccines with us today.
Thank you for having me.